Thing you need to know about the common cold. The common cold is a viral infection that affects the upper respiratory tract. The most common cause is a rhinovirus, and the most common symptoms are a stuffy or runny nose, sneezing, and a scratchy, sore throat. The first signs of the common cold are fairly obvious: a stuffy or runny nose, sneezing, and a scratchy, sore throat. Most people quickly recognize these early symptoms because the common cold is so ordinary. The common cold is actually a viral infection in your upper respiratory tract. A cold can be caused by more than 200 viruses. What are the symptoms of a cold? Once you're exposed to a cold-causing virus, cold symptoms typically take 1 to 3 days to appear. The symptoms of a cold rarely appear suddenly. Nasal symptoms include congestion, sinus pressure, runny nose, stuffy nose, loss of smell or taste, sneezing, watery nasal secretions, post-nasal drip or drainage in the back of your throat. Head symptoms include watery eyes, headache, sore throat, cough, swollen lymph nodes. Whole body symptoms include fatigue or general tiredness, chills, body aches, low-grade fever below 102 degrees Fahrenheit, 38.9 degrees Celsius. Chest discomfort, difficulty breathing deeply. Symptoms of a cold typically last for 7 to 10 days. Symptoms tend to peak around day 5 and gradually improve. However, if your symptoms worsen after a week or haven't disappeared after about 10 days, you may have another condition, and it may be time to see a doctor. Difference between a cold and the flu. The common cold and the flu may seem very similar at first. They are indeed both respiratory illnesses and can cause similar symptoms. However, different viruses cause these two conditions, and your symptoms will help you differentiate between the two. Knowing the difference between cold and flu symptoms can help you decide how to treat your condition, and whether you need to see a doctor. As a rule, flu symptoms are more severe than cold symptoms. Another distinct difference between the two is how serious they are. Colds rarely cause additional health conditions or problems. The flu, however, can lead to complications like sinus and ear infections, pneumonia, sepsis. Diagnosing a cold. Diagnosing an uncomplicated cold rarely requires a trip to your doctor's office. Recognizing the symptoms of a cold is often all you need in order to figure out your diagnosis. Of course, if your symptoms worsen or last longer than 10 days, make an appointment with a doctor. You could actually be dealing with a different health condition, which your doctor will be able to diagnose. If you have a cold, you can expect the virus to work its way out of your system in about 7 to 10 days. If your doctor diagnoses a cold, you likely only need to treat your symptoms until the virus has had a chance to run its course. These treatments can include using over-the-counter, OTC, cold medications, staying hydrated, and getting plenty of rest.